Hello, and welcome to Being's weekly webinar series for Mental Health Month, where we'll be exploring the topic of reclaiming our rights. I'm Omar, and I'm going to be your host and your MC for this incredible webinar series. So today, we're broadcasting to you from the land of the Gadigal people of the Eora Nation, who are the traditional owners of this land. So I pay my respects to elders past, present, and emerging. I also acknowledge all people with lived experience of mental health issues. But I'd also like to acknowledge all people from diverse cultures and including the LGBTQIA plus communities, because an inclusive society matters and our human rights matter. And that's why we're here today, to reclaim our rights. Now, it's a serious topic, but our focus is on informing, inspiring, and empowering consumers to strengthen the hope that we can indeed influence systemic change. We'd also like to, at the same time, recognize the insights, the strengths, and the contributions of people with lived experience through advocacy to lead and influence change in the mental health system and services. And what better time to do that than on Mental Health Month? Now, we would have loved to be with you face to face, but COVID lockdown had other things in mind. And in fact, the last face to face event I did was MC for Being's Consumer Peer Workers Forum in June, just before lockdown. So I'm going to miss that connection of being together with you in person. But hey, here we are. We're live, and that's something. So let's enjoy the process. Now, we're in webinar mode, which means we can't see you, we can't hear you, and you can't see or hear each other. And you know what? That could be a good thing, because if you're at home with a dog or a cat or a family member that likes jumping onto your screen, go for it. Plus, you can make all the noise you want and relax in the knowledge that no one can see you. So although we can't see you, we can certainly acknowledge you. Look, it's been a long, hard year. It's been an even longer and harder lockdown. It's been a stressful time. So if you are triggered by anything in today's content, please reach out for support, either through a peer support service or a telephone service like Lifeline. As always, Being is here to amplify the voice of lived experience and to facilitate new opportunities for learning and growth. And this amazing series that Being has created for you is part of the Being Leadership Academy. I'm so excited to learn from our speakers. So we'll be sharing their insights every Thursday, 11 a.m. Daylight Saving Times, through October. And in the next 3 weeks, we'll be looking at reclaiming our rights through advocacy, the following week through peer work, the following week through consumer research. But today's theme is reclaiming our rights with consumers and survivors driving change. So we'll be taking questions from the audience. So you can look on the right-hand side. There should be a live chat there. So enter them in there. Any topics on today's topic, any questions on today's topic would be great. We'll try and answer as many of them as we can. And if we can't get through them, we'll answer them separately. So should we get started? I tell you, we have a treat for you. I'm so grateful that we have an amazing speaker dialing in live from Canada to share her insights with us. Robyn Priest is a straight-shooting Aussie and self-proclaimed chief non-conformist. So she's been involved in the development of mental health services for over 20 years in 10 different countries, and she's also a highly sought-after public speaker. Some say she's the horse whisperer for mental health advocates. But the way Robyn puts it is that she makes shit fun. Her passion is helping people to go after and live the life of their dreams. And what I know for sure is that she's an expert on reclaiming human rights and one of the most authentic, insightful, and entertaining speakers you will hear. So please join me in giving a warm welcome to Robyn Priest as we chat with her. All right, Robyn, welcome, and thank you for joining us. I'm so excited to chat with you. But hey, I wanted to start by asking if you'd share a little bit about your story, Robyn.
Sure. And I want to say hi, everyone, because you are in my future. It is Wednesday night here in Canada, so you guys are in my future. I'm very excited by that. So it's an honor being able to talk to Australians, and I also know there's some people from my neck of the woods listening. But about me, so at one point, going to be really open and honest, I was the CEO of a community mental health centre, and We had residentials and community support for youth and adults. And it was around that time I got my own diagnosis, and my dad got a diagnosis. And the first thought I had, even though I'd spent my life talking about rights and mental health and disabilities and stuff, I went, oh, I'm one of them. Now, this is a long time ago, right? 87, I don't know, something like that. But it was this 97. I lie hysterically. But it was this place where, like, I realized in that moment that there's so much stigma and discrimination that we need to, like, start addressing it. So I, got a job for something called the Wellington Mental Health Consumers Union. So when anything says a union, it's going to be fighting for the rights of whatever we're dealing with. So, I just started in the, like, peer support world, the consumer advisor, consumer movement. And since then, I've never looked back. And I got to work in New Zealand. I got to work in Australia. And I love coming back and working in Australia. I'm super glad we can do this on a webinar because I can't get back. Australia will not let us back in. And yeah, I got to work in the US, and I got to work in the Pacific, in some of the Pacific nations. And now I live in Canada and have my own business. And I started my own business around mental health education and peer support because I didn't want to be tied down by anyone else's agenda. I wanted to create my own. So, when I was a little kid, I think, I was, I don't know, 5, 4, something like that. I told my mum I was going to fight for the rights, politically incorrect now, not at the time, like the crazies and the retarded people, because they should be able to do the same as me. Little did I know I was going to be one of those people labeled as crazy. And I love what I do. So this topic, I just think we're going to have fun tonight.
It's going to be amazing. And I tell you what, we're so looking forward to seeing you in person in Australia. Maybe even us going to Canada one day as well. Robyn, look, the topic of this webinar series is reclaiming our rights. Can you please tell us how mental health is related to human rights?
Well, I was thinking about that today, right? And I thought, oh, well, I'll take a look at stuff from, like, the World Health Organization. And I suddenly went, oh, look at this. And I wrote down something, and it talks about health is a basic right. Health is a basic right, regardless of age, gender, sexuality, ethnic background, socioeconomic status, whatever it is. And when we think about it, health is about a state of complete physical, mental, and social well-being. But my question is, I don't think the world has parity when we look at mental health and physical health. It's not about this thing about an absence of, and sometimes it's called disease or symptoms or whatever. Like, I think when I think about civil rights for me, or human rights, regardless of what's happening for someone, we need to be able to, like, say what we want. We need to be able to have a voice in this. So when I think about that, when I think about the world in general, if one of us isn't breathing, we're all suffocating. So if I think about human rights should be there, should. I run a course called Getting Rid of the Shoulds. But human rights, I think, is something that all of us deserve, no matter what's happening in our lives, no matter where we are in the world. And so it's that place for me as to why mental health is related, because it's just one of those things that we deal with like every other thing in life.
Well, so well said. I mean, it's so true. Health is a basic right. It does get mixed up between the mental and the physical. And I love what you said about if one of us isn't breathing, we're all suffering. So it's so important. Robyn, you touched on civil rights a little bit in that. Could you explore a bit more about that, please? Because the mental health movement was born out of the civil rights movement. So we'd love to hear from you, your thoughts and insights about that.
Sure. I mean, when I think about this, and I've done a talk on this before about why are we here? Like, why do we do any of this work? And for me, when I think about it, when I think about the history of our movement, right? It was those people in our history who stood up and said, when I lost my freedom, this is Judy Chamberlain from the US. I use her because she's written books and she's no longer with us, but I think one of the catalysts in certain times talking about, I lost my freedom and I said, that's wrong. When we look at people with mental health issues, we think about we're kind of punished. We're punished for experiencing something different, something that maybe some other people haven't experienced. We're locked up. Someone says, "Oh, you're not doing the same as everyone else, so we want to lock you up." And really, what I want to draw a comparison there, and this may upset some people, and okay, I'm okay with that. I'm going to poke a little here and there today. But one of the things I see is, like in Australia and other places around the world, we took kids away from their families, Indigenous kids away from their families, because we went, oh, we can make them look different and they'll fit in better here and have a better life. Here's my question. Is it any different when we take someone with a mental health issue and we go, oh, they don't kind of look like the rest of us or act like the rest of us, but if we bring them and put them in here, they'll be safer, or they may start to look like the rest of us and do what everyone else does. Are we doing that for the person, or are we doing that because it makes the rest of society comfortable? There's also the place for me, the connection with the civil rights piece is I think about that piece about women, right? And women working and women's rights and being able to be equal parts of the community. If I think about like adding a little around peer support in there, right? Peer wages are often a lot less than some of the other wages just because it's a job with this person has a mental health issue. And I don't say that flippantly, because when there's been comparisons done of jobs, sometimes peer workers are doing the equivalent of other jobs, but not getting the same pay. Not the same job, but the equivalent work stuff. Don't run away from me yet, because I'm still talking, Omar. We came back to the whole screen. I was like, no, I'm still chatting.
Me too. Keep going, Robyn. Keep going. This is amazing. Yeah.
So there's a piece for me there about, like, where's the parity? Where's the parity in that? Like, women don't get parity. People with mental health don't get parity. They don't get parity when they go to get treatment for a physical issue, because there's this stigma about, oh, you're not having a heart attack, must be a panic attack. Like, I know someone who went and died in the hospital because the hospital thought it was a panic attack when it was a heart attack. So there's stuff around that when I think about those pieces. There's pieces for me about, do we have separate entrances, separate toilets, separate places like that? If we go back to thinking about civil rights with, like, the Black community in the South of America, there was this, well, you sit over there, you do this, you can't go here. And I think that sometimes happens when we look in our community as well. I'm going to share an example. I don't have mentally person tattooed on my head. I'm sorry, I'm politically incorrect. And I went to do a talk and someone said, oh, the bathroom is over there. And I went, what's that bathroom? And they went, that's for the people with mental health issues. And I walked in there and they're like, no, you're in the wrong bathroom. I'm like, no, I'm one of them. Because, this is me being a little out there, but, like who says we should be using different bathrooms? Who says we should be using different entrances? Who says we deserve less treatment when we go to get things? So why do we have people locked up? They're either locked up in hospital or locked up in prisons. Why do we have like the number of homeless that we have? Like, I know some of my friends have chosen that and I'm cool with that. But what are we doing? And I think when we think about why is it civil rights? Why was it born from that movement? Because that was the movement that said, we need to be at the table. We need to be deciding for us. And the disability movement was nothing about us without us, right? I heard Ellie Hodges from South Australia say something recently, and I actually like it more than nothing about us. She talked about by us, for us. And I love that. And I've started using that across the world because it is like, where are we engaged in this? So, sorry, I got a bit passionate, but it's the intersectionality of all of those civil rights movements that we get to stand on, and we get to stand tall and proud if we choose to, right? If we choose to.
Amazing stuff. I think I love what you're speaking about. You included women, indigenous cultures, Black Americans in the South, and it's everywhere. I want to just, whilst we want to focus more on the hope and the aspirations, I do want to poke a little bit deeper onto this particular question, if I might, Robyn. What happens when the system tries to force us or make us like everyone else? Can we just cover that, and then let's get more into the hope side of it. But I'd love to hear your thoughts on that.
I think one of the things the system continually tries to have us look like what the rest of the system looks like, or what society wants us to look like, what people call normal. And I think one of the things that I love about our youth is our youth are saying, there isn't a normal. We get to explore, we get to unpack, we get to create new ways of being. Now, the one thing that I see in this, that when I'm thinking about that question that you asked, and I'm going to open my page and take another look at the question to make sure I get at that, but it's are we labeling ourselves again? Are we just changing the label? Are we changing boxes that we fit in? And I'm up for grabs on this. I'm really up for people to kind of ask me questions and respectfully challenge me on this. But I hear all these new terms. Like, I'm not going to think about the mental health stuff at the moment, but I think about all the new terms coming out of the LGBTQI, if you're in Canada, 2+, two-spirited, and think about all the different labeling in there. Like, are we just taking another box and putting ourselves in a different box? And I think one of the things when we start to kind of think about a system wanting us to fit in, it impacts our mental health, right? So we're trying to go to something for mental health, and then we're being impacted because we're trying to fit in. And so I think there's pieces there that we need to look at. And I'm going to ask you to ask the question again, because, I rambled and I forgot where I was going.
And I know sometimes the rambling is just so beautiful because, again, you are the non-conformist, remember, and I think it's just lovely that you're bringing in all of these different nuances to it. So, I think what I was struck by everything you said, but I think from the one side is the catch-22 about our system when you get kind of caught into it. The other one that inspired me was when you mentioned the youth. Was imagine youth as kind of revolutionaries and fearless and driving change. So yeah, both sides. Let's maybe focus on kind of the hope side, right? Why do we need to reclaim our rights? Why do we need to do that? And Robyn, what does it actually even really mean? So yeah, another big question for you.
God, I'm just like, my
we,
brain's
we,
like chipping away at all these things. I think one of the things I wonder is, are we reclaiming our rights, or are we claiming them for the first time? Like, and now that depends for people, because I think sometimes when people with mental health issues get diagnosed really young, I don't even think they ever knew they could claim their rights. I'm not sure that we knew, like, how do we claim our rights in this system that often takes them away? So I think when we think about the reclaiming piece, I think it's reclaiming or claiming our rights. And I think there's pieces that, like, we've internalized what people have told us. So we hear sometimes that, like, we can't do this because we have this mental health issue, or we have to be really careful about our mental health because life might trigger us. And one of the conversations I've had with people in the past is living below the poverty line is like more triggering than some of the like experiences of going after like a job and dealing with that. I think reclaiming our rights is sometimes unlearning learned helplessness. Like I think we get stuck in that place. Sometimes we get stuck in that helplessness place. Like reclaiming our rights is saying we have a right to dignity. So that whole conversation about duty of care versus dignity of risk, right? We need to be able to risk because the world risks. Like we don't walk around to the general population and go, oh, you made a dumb choice. Oh my God, what are we going to do with you? But often when we have a mental health issue, there's this lens on us that is going, oh, if you do the wrong thing, we'll have to do something with you. And I think the place is reclaiming our right of dignity. It's the place about we get to expect our civil rights to be upheld instead of hoping they are. And so, I mean, there's a couple of things I'm I want to throw out here in this conversation. If I think about what's happening, I think sometimes we have Stockholm syndrome, right? And I think it's this place about like we're in this system, whether we're using it for our health or we're in it as workers, and we're with people that keep telling us stuff, and there's a point where we just go, oh, I'm just going to be nice to you, and I'm just going to follow what you say because it's tougher if I don't. Like the ramifications of that. If I think about sometimes, if I think about a consumer advisor position, I think they still call them that in parts of Australia, is that place about Like, oh, if I push them too hard, am I going to lose my job? Right? So we've got that. So there's we want to start thinking about what do we do, say, and policy that changes that piece. There's two other points I want to make here, and is the whole discussion around recovery-oriented practice. Yeah, I'm going to poke some stuff here. If we talk about the concept of recovery, self-determination is one of the biggest concepts in recovery. But when I read the Australian recovery-oriented practice guidelines, it talks about sometimes we have to do compulsory services with people and have them comply. I'm not sure how compliance and compulsion goes with self-determination. So for me, there's an issue there. That's a rights issue for me. I know I might never get work in Australia again now with government hearing this. The other thing I want to talk about, and I was talking about with Paula from Queensland last night about the C word. The C word, co-production, co-design, and the place where we have people say they want to hear what we've got to say, but then it's like, we heard you, but we're going to do what we want because we think that makes more sense. Or we've just stacked the numbers a little more to people who are going to toe the line. And I think for me, when I think about that question about why do we need to reclaim our rights, for those reasons, to stand up and say, we do actually know what we want and what we need if you give us, well, no, actually, if we take that back. So I think there's places in there I really want to push, and, you know, there you go.
It's great. I mean, you're actually taking the title of the webinar and lifting it up a notch, you know, in terms of not just reclaiming, but claiming for the first time. That's very powerful. And then secondly, our message of hope. You're lifting that to a message of expectation. I love it. I love it, Robyn. We've got a couple. This is striking a chord with a lot of our delegates. There's some comments coming. You sort of touched on some of them. There is one. Oh, okay, cool. So one question that came through was self-determining our own path of recovery versus quote unquote professionals, treatment plans and anticipated paths. You sort of touched on it. Did you want to expand a little bit more?
You know, if I think about it in terms of a question, like what do we do about this? We're tackling, that's a worldwide issue, right? Because recovery, the concept of recovery came from us. It came from us in the 80s. And I'm looking at it going 40 years later, services are now recovery-oriented guidelines and talking about models and, oh, we'll just put this in a treatment plan. For me, recovery is not a model. Recovery is a philosophy, a way of being with individuals that allows them to explore for themselves. And so when I see that question, and I'm just going to ask, can the question just go back up again so I make sure I cover it off? But that piece about, for me, I am continually saying to professionals, this is not about what you want for me. This is about what I want for me. And when I think about peer support, and you guys will probably talk about this in session webinar 3, right? For me, my job as a peer worker is nothing more than, I talk about it as being an exploration facilitator, that my role is to support the individual to explore what they want for themselves. I facilitate people to explore for themselves and then be able to stand up and say, this is what I want. So it is that place where I'm going to ask all of us to stand up and reclaim that like it's our recovery. And it may not look like clinicians want. I've just running some training today where I was talking with some peer workers about the whole recovery concept in the addiction world, right? And someone's going, well, that's only if you're abstinent. And I'm like, no, it's not. Abstinent maybe for one, harm reduction for another, medicated assisted for another. Recovery is a concept that's ours and ours alone as an individual to determine. Some days my recovery is I get from the bed to the couch. And that's my recovery on that day. And some days my recovery was getting on a plane and flying 40 hours, changing planes 3 times and going to Guam. And so it's that piece that we have to keep saying and getting support to say, if we're the one wanting to say it to a clinician, where do we get supports to come with us, to stand with us, not say for us, but advocate with us, and for us to keep educating. I hope that we keep running things like Being Run stuff for professionals that says this is about people working it out for themselves, not someone telling them. I remember Faye Jackson once said, who gave someone the right to take away my best friend? One of the voices she heard. So sometimes we're told we have to lose things like that to be better. And sometimes it's how do we work out how to be with that, right? Instead of getting rid of it. I don't know if that answered the question. I hope so.
Yeah, you answered the question and raised a whole bunch of other questions, but this is beautiful. We've got to, let's just stick on this for a couple more moments. We've got a few more comments. So let me just mention them to you and maybe you could touch on, well, let's go grab this one then. Okay, there's a whole bunch of them. I think probably got time to answer this one and then we'll move on in the session. So from Leanne, homeless people in general have to spend so much of their day just figuring out how to meet their basic physical needs. How do we help them reclaim their rights related to mental health?
Yeah, good on you. Now I have to be intelligent. I'm not, well, I think for me, when I think about, I do some work here with the homeless, like organizations. I do some work with training peer workers who work in those organizations. And I think the piece is, for me, it is the place about how do we look at the system? How do we create and keep saying to the system, why aren't we listening to the individuals who are using it? Why aren't we actually having a conversation with the individuals about what they need and doing that? So I know in some places there's been brokerage models where they've gone to people and said, and I don't know if the NDIS covers this at all, so I apologize, where people have said, I just need to be able to access some food and I need to be able to access a bike and I'm good if I can access those. And so brokerage models are giving people that. I think, I don't know if I'm answering this question, but I think the point for me is systemic advocacy to say we've still got people whose basic human rights of food and shelter are not being met. Why are we not doing something about this? But asking people what it is that they want, instead of going, oh yeah, someone wants a house. Like I always talk about an example when I was supporting someone in a multidisciplinary team and the team were like, you're homeless, you need a house. And this person went, no, I don't want a house. I just want to get laid. And the team were like, no, you have to have a house. And the guy got pissed off, left the room. I went out after him and I went, dude, I really get the frustration. Can I just ask you a question? Because you've been sharing who you'd like to sleep with. He goes, sure. I said, I know because you're homeless, you don't always have access to, hygiene stuff. And you've talked about the kind of person you want. And maybe like the hygiene's an issue for them. And he walked back into the meeting and goes, I need a house so I can get laid. Here's the kind of house I want. And so I think, yeah, it's those things. And Leanne, I'm sorry if I didn't answer your question. I hope I did.
I think it's so difficult to contain all of your wisdom in an hour, Robyn, let alone this entire topic. So I think it's just wonderful what you're sharing. Let me just move on to another core question here, in terms of how can we promote and protect our human rights in the mental health space? So moving forward, what do we need to do to promote and protect this?
Well, I think there's a piece for me about get out of our heads. So get out of intellectualizing everything. We get into this place about the way we talk about it, the things we talk, and if we start sharing the stories of like people's experiences, like they're powerful. And I know we do, but I think we still get into this intellectualized place. I think it's the place of not just putting, like it's not just the absence. A friend of mine, Lynn Legier from the US, talks about it. It's not just an absence of negative messages in a person's environment. Like that's more powerful than the mere presence of positive messages. So I think what we have to start doing is looking at, like, in services, in areas, like what are the logistical things? What are the furnitures? What are the language? What are our body language? What are the choices, options, and alternatives that we start to share and create? And I think it's those places, and it's the place about saying if we keep doing the same old, we're going to get the same old results. So I know that hospitals for some people are great, and some people choose that as if I'm in crisis, I'm going to go to hospital. I'm like, cool. For other people, they've talked about that just makes them sicker, right? And some people have said, if I had a bed and breakfast for a week and someone went and sorted my house, actually I'd do better. And so I think part of it is, for me, how do we keep having the conversation about what are the alternatives? What are the other things? And I think one of the things for me is we often look to the government, and I guess I might rattle a little here. We look to the government for funding. And we're always like, we need more money. So I have a couple of things. I just had a conversation here in Manitoba with senior government going, it's not always about more money. Sometimes it's just about rejigging the money that we have, but it's also sometimes just taking a stab at it and doing it. So, and then pulling some data behind it. We have to have some data. Like, we have to start showing when people's rights are upheld, the difference it makes to people's lives, right? So I think we need to start doing that. I think we want to start looking for allies and not, I have to be cognizant and careful of how I say this. Sometimes we have people who call themselves our allies, but when we get into it, maybe they have a different point of view. And this is maybe the place where I could get in lots of trouble. But my business partner is a family member, and I'm a family member and an individual with my own experience. Now, whenever I'm in meetings, I stand as the individual with my own experience. My business partner, Charlotte, stands as the family member, right? Because there's times where we have different viewpoints. So sometimes we have, like, I don't know if it happens in Australia. I'm fairly sure it would, because it happens all over the world. But sometimes we have people go on advisory committees and stuff who are like, I'm a family member and a person with lived experience. I can be both. And I want to say, you cannot be both in those meetings, because there are times that an individual and a family member are going to look at something from a different perspective. So this is one message I want to say super clear. Like, pick a lane. Pick a lane and be that lane amazingly. But don't try and do both, because it gets muddled. It gets confusing for the people that we're trying to like support. It gets confusing for governments. It gets confusing for funders, and the message gets muddied. So I think there's pieces about that. Let's start writing stuff. Let's start writing our stories. Let's start writing reports. Let's start blogging. Let's get the message out, because I don't know how many people are still out in our community that have never even heard the word recovery. All they're told is they have a mental illness and this is their life. The best we can do is maintain and stabilize you. I don't want to be maintained and stabilized. I know some people love those words. I'm cool. I want to live an amazing life and go after my dreams and hopes. I don't want maintenance and stability. And so I think there's places where we want to start looking at our language. I think there's a place for me where, you know, if I think about how do we promote it and protect it, we stop fighting each other. Like, we fight each other. That person said that. I don't agree with them. And the rest of the world looks at us and goes, they're fighting amongst themselves. Obviously, yeah. Why would we listen to them? And so I think organize, mobilize, prioritize. That came from a friend of mine in North Carolina. Promise Network is a peer-run service there. They're amazing. And realize that we don't have to get it right all the time. We don't have to get it perfect. We just have to pick a priority and actually take an action. Because I think sometimes we in our movement are great about bitching about what's not working instead of standing up solution focused. And maybe we don't use government funding to try something. Maybe we look at funding from like people in our community and show something working and then say, okay, this is working. Here's the data. Come and do it.
I love what you're saying, Robyn. I mean, you're telling us to get out of our heads, do some practical things, pick a lane. I love the organizing, mobilizing, prioritizing. This is really good advice going forward. We've got maybe 15, 16, 17 minutes. Just wondering, I'll try and bundle up two questions into one because you've touched on it, but your suggestions for others who are starting out on their advocacy journey or interested in becoming involved in systemic or individual advocacy. So your advice to others, but also maybe I'll give you two questions in one because you've got so much happening here. Could you talk about picking a lane and the balancing act, you know, between storming, fighting and collaboration, between rocking the boat and protecting our interests, between is the documentation there and can we implement? There seems to be lots of contradictions. So your advice, how do we channel through these contradictions or opposing forces, whatever you like to call them, and your advice to all the wonderful people listening today in terms of, you know, how do they move forward on their journeys, Robyn?
Okay, well, if I want to take the storming, fighting and collaboration piece first, all right, if I think about that, I am not the storming, fighting person. Like, I'm the person that pops in behind, or even if there hasn't been that storming, fighting like person, I'm a person that goes in and talks about collaboration. I think we need both. So I think if there's people out there that like going in and saying, come on, rah, like if we think about the Black Lives Matter movement, right? There's people out there like standing up, yay. And I'm like, yes, we need that. So I think if you're one of those people that wants to shout loud and proud, like be that person, like stand up, take a step, go in, have a meeting with someone and tell them what you think. I think we need the collaborators to come behind. So what I often tend to do is hey, I actually want to make your job easier. Like, here's how I think it will be easier. And so I share this solution-focused piece, right? The workforce is always talking about mental health workforce, always talking about not enough workers, not enough this, don't have time to do their job. So when I'm selling peer support, I'm like, I want to make your job easier, and I want to make time for you to be able to do your job, because here's someone that will do theirs well, and technically you'll be freed up. That's like here at the Crisis Response Centre, it's like a psych emerge. We put peer workers and family workers in, and they have found, the clinicians have found they have more time to do what they trained to do. And now they're like, we can't live without them. So it was a pilot, and they are fighting for us now because we went in with that collaborative thing. So I think about which is your lane, which is your mojo. The other thing, truth be told, so maybe you need to find some foreigners. I've been told here sometimes that after a meeting, people realize I've hit them over the head with a sledgehammer, but my accent was so cool. So I'm being frivolous. Maybe you find someone with a cool accent and use them, because people get excited about the accents. I talked about the family carer. I'm looking at some of the questions here. I talked about the family carer and individual perspectives. Pick a lane. The rocking the boat and protecting our interests. For me, rocking the boat is protecting our interests. So, like, they're one and the same. I think the place that we do it, I always talk about, if anyone ever does training with me, I always ask people if I can give them a respectful challenge. And I tell them respectful challenges are me just having a conversation, to have them just take a look at something a little differently, and that they can respectfully challenge me. But I also, in terms of that rocking that boat, I take some research stuff with me. There's some good research out there, and you've got that webinar coming up about consumer research. I think it's the 4th one. So there's that. But what am I saying to people? Find what you're passionate about, because we're all not passionate about the same things. Like consumer advisor bodies, peer support, like lived experience, like leaders, lived experience workers. Find the place that fits for you. Find people that are doing it already. Connect with them and take a step.
Perfect advice. I mean, this is really so good. I love the fact you also said rocking the boat is in our own interests, respectful challenges, actions, move forward. It's very inspirational there. There's
I've got
a lot of things.
one other thing I just want to jump in. Sorry. I always talk about being passionately curious. So I talk about that as a peer worker, but I talk about that in meetings when I'm talking about this kind of systemic advocacy stuff. Be passionately curious about the other person's point of view, and you actually get them to come into a conversation differently.
I love that. Passionately curious. I mean, this whole session has been lots of hashtag quotes. I mean, the semantics.
Oh, they're mine. No.
I know they're all copyright. I think we have some passionately inquisitive members of our audience that want to ask some questions. Now, can we flash some more questions on the screen there? Leonie, Peter, if you have them. Let's see what happens now. Or not. That's cool. Okay. An elder said that we have to stop asking the government to solve social issues like homelessness, because we have to break the rules, which governments can't do.
Yeah.
Robyn.
And that's the kind of piece I was saying. So whoever said that, thank you, thank you, thank you. I love it. Right? It is the place. Governments are boxed. Here's the structure. Here's the system. you have to fit in here. It's brave governments that step out of their boxes and their comfort zones. Truth be told, we just got funding, the first ever funding in Canada, from an Indigenous organisation called Jordan's Principle, where we got like a full-time peer worker and some family peer support hours for a young person and their family. And they basically said, do whatever you have to, like sort them, as long as you don't go over the actual amount of what we've given you in funding. Brave organisation. It's Indigenous, so I'm like, thank you. But I think we have to look beyond government, because government do have that. And that's what I was saying. Charlotte and I didn't have any money for our company. We didn't take a loan and we went, screw this. We want to create what we want to create. And we took a gamble. 3.5 years later, we're still going, which is good. We gave up our jobs 3 years ago. And we keep creating different things. So we go to community and ask community if they'll support us to do things. We look for different contracts that don't have the same kind of constraints. So it is about breaking the rules. Truth be told, I'll ask after. I'll apologize after. I'll push the boundaries and apologize after.
Here's another one for you. I love the message I'm getting, that we can work more towards what we do want and less about what we don't want, and get more results.
Yeah, it's the piece for me about, if we are always going with the problem instead of going with the solution, like how many of us want to keep hearing the same old problem? And we know it. I think everyone knows it. But if we go with this is what we want and this is what we're after, it's kind of like dreams and hopes. We don't go, well, I know I don't want a partner that does this. We go, I want a partner who's like this. And then we go after it. And I think it's the same thing. So thank you for that message.
Before we get on to the next one, I think I just want to echo what you just said about what we want rather than what we don't want. It's the Pareto principle. It's the 80-20 rule. So 20% on the problem, 80% on the solution, because that's where our energy goes. Yeah. Sorry, I think we had a question flash up. It's not made. Oh, this is lovely the way they pop in and out. Robyn, do you think organising ourselves into community alliances to work on projects funded by NGOs is a good way of going?
I'm a big fan of collaboration. I'm tired of, and I'm going to say this generically worldwide, of our community being fragmented. And I want to say, stop comparing male anatomy sizes. I'm just going to put it bluntly like that, right? Stop being in a pissing competition with the other people in your community. Get together and say, what do we need to do? What is this? And I mean, there may be a couple of NGOs, and work out which one's the best fit for that. We don't all have to be doing the same thing. We can actually work together on projects and say, you're really good at that, we're really good at that, and support each other. So I love community alliances. I love us having strength together instead of pulling each other apart. And that takes something, because sometimes there's wounds there. And if we can sit down and kind of look at how do we use trauma-informed practices around those wounds, we have a better shot.
We do. And that message about being stronger together is just so salient, isn't it, really, in just life generally. All right. I'm enjoying this. Is there another question to pop up on our screen?
Hey, just before we get to another question, one of the things I want to say is we have values of how we would work with individuals in peer support. Why aren't we doing that with each other in services? Whether it's clinicians or whether it's other peer workers or whether it's like family members, why are we not utilizing those peer support values in everywhere that we interact with a human being? That's all I want to say.
Beautiful. Cool. This one. What's your take on no rights being enshrined in Australian law and the only OECD nation without a so-called Bill of Rights, Robyn?
Look, I think the reality is many countries have a Bill of Rights and they're completely not listened to. So, you know, I think the piece is that the World Health Organization has a Declaration of Human Rights. And although it's not something enshrined in Australian law, I think that's the piece that we can stand our hat on. And keep talking about that. The Universal Declaration of Human Rights is for every single human. So I would keep doing that because, like, I know countries just override the Bill of Rights willy-nilly all over the world.
That speaks also to what you were talking about, the balancing act between storming and fighting and collaboration, rocking the boat, protecting our interests, between the documentation that's there and the implementation that's there. So it's a very, there you go.
It's the piece for me. I know we've only got a couple of minutes left. I could chat forever. I'm hopeless. But it's the piece for me about let's start sharing those stories of where people's rights were met and the amazingness that occurred. And we also have the capacity to share where they weren't and the things that didn't go as well as they could. But if we can start sharing, here's where they were met and look at this amazing outcome.
So we only have a couple of minutes left, but I think you're leading into that kind of conclusion that I'd love from you. You're talking about the sharing, just in terms of a final word to wrap up and leave the audience perhaps with one call to action. It's very hard because you've had so many amazing suggestions. So I hope they'll take in all of this, and the recording is available later. But one last message, call to action for our lovely delegates that are watching. What would you say, Robyn?
Take one step. That's all you have to do, right? One step. Find something you're passionate about and just take one step. Like an example really quickly, when I was running a service, like there was a thing in New Zealand where you weren't allowed to have health services in a certain area. I wrote something to the local paper, which went the next day to the national paper, which went the next day to the current affairs show.
Yes.
And like I had no idea that was going to happen. So it's that place about that ripple effect. We throw that little rock in and the ripple goes. Yeah. So find what you're passionate about, right? You don't have to do stuff you're not passionate about. And find your mojo and way of doing it, right? And it might look very different to mine, right? It might be a quieter approach. It might be a louder, but just one action. That's all you have to do. Just take that first step. It's that step from our comfort zone through the fear zone.
Wow, that is beautiful.
Our allies to help us do that.
So find out that thing we're passionate about and just do that one step. And maybe that's the most powerful thing that we can all do in our lives moving forward. That is so poignant, Robyn. It has been such a pleasure and an honor to chat with you and listen to you today. I mean, we could go on for hours and hours, but I just want to say thank you. So I want to thank Robyn for a beautifully connecting, entertaining and powerful way that she brought clarity to the complexity of human rights. Kind of she weaved the past through the present into insightful recommendations for the future, and also balanced all these opposing forces and kind of encapsulated in that one message going forward. There is a final call to action for us as a group. Before that, quick plug for the next webinar next Thursday, 11 o'clock, daylight saving time. We'll be reclaiming our rights through advocacy. This is available as a recording. But in thanking Robyn, one call to action we'd like to leave you with. And that's a final message, one of hope. Maybe we'll change it to expectation after what Robyn has said. We expect that we as consumers can advocate for and influence systemic change. We ask the government to sit up and act on what consumers have to say. We ask decision makers to listen to the insights of our speakers on how we can improve our systems and infrastructure to support the human rights of people who live with mental health issues. We expect that consumers and survivors driving change can and will reclaim their rights. Thank you. We'll see you next week. Thank you, Robyn.
Everyone.
Thank you so much.